So there are 5 core actions that we all experience or do every single day. And I call them core actions and not habits. And that's one thing I want to point out because these things are defining to who we are. And the medical literature is quite clear that these core actions are impacting our mental health quite profoundly. And there's no question about that. It starts with foods. We are, as I mentioned earlier, eating an incredible amount of sugar and processed food. Something like 75% of the American diet is ultra refined. These foods lead to neuroinflammation. Omega-6 fats, which are in our vegetable oils, which are in everything, make it hard for our brains to use the serotonin that we have and create brain level inflammation. And on top of that, we're not getting some of the antioxidants and phytonutrients in whole foods, in whole fruits and vegetables, in whole grains, as opposed to processed grains that are critical for our bodies to combat inflammation, to make neurotransmitters, have healthy immunity. And so I talk about food a lot in the book, and we have a recipe, a prescription for how to eliminate some of the worst offenders and how to eat a whole foods diet. And you would not believe the degree to which people experience greater clarity, greater energy, reduced brain fog, less anxiety, better sleep, just through some of these simple dietary changes. So that's the first one. Exercise as well. As I mentioned, we're sitting 11 hours a day, and the body is designed to process emotions through movement. When we have a thought, that thought could be, wow, I'm nervous about this interview. That thought could be, wow, I'm really stressed by my email today, or I've had a fight with my partner. An emotional reaction triggers a biochemical wave of neurotransmitters and hormones through our bodies. And these waves over time increase blood sugar, increase insulin, suppress our immune system, and actually lead to damage. So when we say we store our emotions in our bodies, it's actually physiologically true. And the research shows that in certain trials, people with anxiety and depression showed improvement 95% of the time through adding in exercise every day, and only 40 to 60% by taking an antidepressant. We should, as a medical community, based on the literature, be prescribing movement and exercise for any patient experiencing these symptoms, but we're not. The next one, number 3, is technology. We need to cut our screen time and take back control from our relationship with tech. Now, tech is important. It's how we work. It's how we shop. It's how we communicate with our loved ones. But mobile device addiction is real. Our social platform and news platforms are highly addictive. They trigger the same reward systems in the brain as sugar and even cocaine. So that's the dopamine system. And we are spending far too much time on screens, and it is depleting the gray matter in our brains. It is disrupting our sleep. For women particularly, it is proven that social platforms are depleting our sense of self and our emotional well-being. We have to set limits. Those limits can include, in my recommendation, taking at least 1 hour before bed, totally screen-free. Scrolling before bed is disrupting your sleep. Even if you have a blue light filter on there, it is stimulating your brain, and that stimulation has been shown to result in not achieving the full sleep cycles that you need to heal your brain and restore overnight. We also need to set timeouts and limits on our social media and newsfeed consumption every day, and I recommend setting an hour for each of those as well. And try having a screen-free weekend day or screen-free morning. Remember how to invest in our IRL activities and social connections so that our bodies and brains get a break. The next one, speaking of sleep, is sleep. Most people don't need 6 or 7 hours. That's a myth. We need 8 to 9 hours at minimum. And we really need to go to sleep by 10 p.m. And that's because oftentimes we're having a second cortisol spike, that second wind that people describe getting around 11 p.m. or midnight. Well, that's physiologically real. And we don't want that. At night is when your brain washes itself. It takes out the metabolic trash that is critical for good ultimate cognitive function as well as for mental health. For a lot of people, sleep deprivation, chronic sleep deprivation, which could just be as much as getting 6 to 7 hours a night instead of 8 to 9, is masking as depression. It also leads to poor choices the next day. What do we do when we're tired? That extra cup of coffee, and then we're jittery, and then we eat too much, and we eat some of the wrong foods. And then you're wired from all that caffeine and sugar during the day. And then what do you do at night? People often turn to that glass of wine. And so that brings me to my final, which is alcohol. And I think we have unfairly categorized the problem with alcohol as a black and white problem, meaning you have alcohol addiction or it's fine. And I would argue that for many people, there is something in between called alcohol abuse, where it's disruptive to sleep. It keeps your body from reaching the lower body temperature and lower heart rate at night that you need to achieve to have that deep sleep. It also is in and of itself a depressant and a toxin. For a lot of people in our patients, we recommend max 3 days a week so that more days are off than on. And that can be a really powerful reset. And then, of course, as we know, alcohol addiction is something completely different. And for people dealing with that, then nothing is the answer. And so these are the 5 core actions, because again, they're not habits. They're core to who we are. They're things that we do multiple times a day. They dominate our lives, and they define at baseline whether or not we are going to have more positive mental health and emotional well-being, or whether or not we are trying to climb Everest when it comes to mental health, but we can't even get to base camp.